Hiding in plain sight within your bloodstream is a protein that does more heavy lifting than almost any other. It's really the unsung hero of our circulation, and honestly, without it, our bodies just wouldn't work. We are, of course, talking about serum albumin. And if you want to get a sense of just how important this protein is, all you have to do is look at what's actually in our blood plasma. You'll see one protein just absolutely dominates the mix. See that massive slice of the pie? Yeah, that's all albumin. To put a number on it, albumin makes up a staggering 60% of all the proteins in your plasma. So it's not just a protein, it is the dominant protein in our bloodstream. So come on, let's get to know it a little better. All right, section 1. Let's cover the basics. What exactly is this stuff? Well, for starters, it's a relatively small, kind of ball-shaped protein, and its production factory is the liver. And what a factory it is. A healthy liver pumps out, get this, 12 to 25 grams of albumin every single day. That is a huge amount, which right away tells you its job must be pretty darn critical. And that brings us to its two main roles. You can really think of albumin as having two incredibly critical jobs in the body. First, maintaining pressure, and second, running a massive transport service. First up, let's talk about pressure. Specifically, something we call colloid osmotic pressure, or COP. The easiest way to think about it is that albumin is like a giant osmotic sponge. Because there's so much of it packed inside your blood vessels, it creates this powerful pulling pressure, which is absolutely crucial for keeping water inside those vessels and out of your tissues. And this visual, it shows that balance perfectly. On the one hand, you've got blood pressure physically pushing fluid out of the vessel, but that's normally balanced by the osmotic pull from albumin, which keeps the fluid in. But look what happens when albumin is low. That pull gets weaker, the balance is lost, and fluid starts leaking out into the surrounding tissues. So what does that leakage look like in a real person? Well, it looks like this. It's called pitting edema, that little indentation left behind after you press on the skin. That's the clinical sign of all that excess fluid trapped in the tissues, and it's a direct result of that low colloid osmotic pressure. Okay, but keeping fluid where it belongs is job number 1. That's only half the story. Albumin's second critical job is acting as the body's system-wide taxi service. So who are the passengers in these taxis? Well, it's a whole mix of really important stuff. Albumin binds to and carries around fatty acids, bilirubin, all sorts of hormones, and even metal ions like calcium. And this is a big one for medicine. It also transports many therapeutic drugs through the bloodstream. And this is where it gets super important, clinically speaking. If a patient's albumin is low, it means there are fewer taxis available to carry drugs. This means more of the drug is just floating around free and active in the blood at any given time, which can totally alter its effect or even make it toxic. The dose you prescribe might not be the dose the body actually experiences. And that, right there, is the perfect lead-in to our next section. What happens when these levels drop? Let's dive into the causes and effects of a condition called hypoalbuminemia. All right, so what actually makes albumin levels drop? Well, there are a few main culprits that every medical student has absolutely got to know. First up, and this one's a big one, is liver disease. And it makes perfect sense, right? We just said the liver is the albumin factory. So if the liver gets damaged by something like cirrhosis, it just can't produce enough albumin, and the levels in the blood are going to fall. It's as simple as that. Okay, cause number 2, kidney disease. Now, in this case, the factory in the liver might be churning out albumin just fine, but we're losing the product somewhere else. When the kidney's filtering systems are damaged, they can't hold on to large proteins like albumin anymore, and it just starts leaking out into the urine. And then, of course, you've got a couple of other key players. Severe malnutrition is one. I mean, if you're not eating enough protein, the liver literally doesn't have the raw materials to build albumin. Then there's chronic inflammation or heart failure, where the body kind of shifts its priorities and starts making other proteins instead, so albumin production goes down. Okay, so we know what it does, and we know why its levels might be low. But how do we actually, measure it? How do we diagnose this stuff in the lab? Well, in the clinical lab, we've got two main windows to peek into a patient's albumin status. We can measure its concentration directly in the blood serum, or we can look for it where it's not supposed to be, in the urine. For serum, the go-to test is this really elegant and honestly pretty simple method using something called bromocresol green, or BCG dye. The way it works is just so clever.
At a slightly acidic pH, albumin gets a positive charge. The BCG dye, meanwhile, has a negative charge. Opposites attract, they bind together, and they form this new blue-green color. The more albumin you have, the more intense that color gets. Simple.
Okay, but what about urine? Well, here the game completely changes. We're not looking for large amounts. We're on the hunt for tiny trace amounts, a condition we call microalbuminuria. And finding this is so important because it's often the very earliest warning sign of kidney damage, especially in folks with diabetes or high blood pressure. To get a really accurate picture, we look at its ratio to creatinine. Now, a result under 30, that's normal. We're all good. But that range from 30 to 300 micrograms per milliliter, that's the microalbuminuria red flag zone. It's the zone that makes us say, uh-oh, something's up. It tells us the kidneys are just starting to leak, giving doctors this incredibly important window to step in before major damage is done.
So here's the big takeaway, the thing you absolutely have to remember. A low albumin level isn't the disease itself. It's a powerful symptom. It's a clue from the body that something bigger is wrong, with the liver, with the kidneys, or with the patient's overall health. So when you see that low albumin on a lab report, the real question you have to ask yourself is, what story is this number telling me about my patient?